Everywhere you look in this administration, there are irresponsible people making terrible decisions on life or death matters. And thanks to the major debacles of Pete Hegseth and Kristi Noem and Pam Bondi and Kash Patel keeping everybody occupied, Robert F. Kennedy Jr., who leads the Department of Health and Human Services, has mostly been off the front pages. But make no mistake, his department has done serious long-term damage to American health and safety, and things could get a lot worse. Just since he's been in office, Kennedy has overseen the country's largest measles outbreak since before we eliminated the virus in the year 2000. For all effective purposes, it was gone from the United States. Last year, 3 people, including 2 school-age children, died from it. This year, measles cases are rising faster. The epicenter is now in Utah, where there have been nearly 600 confirmed cases of measles, surpassed only by South Carolina and Texas, where just last year, dozens of kids wound up in the hospital with both measles and signs of liver damage. Liver damage because they took cod liver oil that RFK Jr. recommended as a cure for measles instead of a proven vaccine. There is no cure for measles. There is only the vaccine, which is 97% effective. But RFK Jr. doesn't like vaccines, and so that shows up in everything the HHS touches. Today, the Washington Post reports that the CDC is burying a public health report that was supposed to have been published 2 weeks ago, a report that showed the ongoing success of the COVID vaccine. According to whistleblower scientists, the report says, quote, the COVID-19 vaccine cut the likelihood of emergency department visits and hospitalizations for healthy adults last winter by about half. Apparently, the CDC director had concerns about the methodology, which has been used to evaluate the flu vaccine for 20 years. Abdul El-Sayed is a physician and an epidemiologist. He served as the director of the Detroit Health Department. He's now running to represent the state of Michigan in the United States Senate, and he joins me now. Great to see you.
Always good to be here.
We're going to talk about your run momentarily, but it's sort of opportune that you're here because I think we have to keep coming back to this health question. There are people who think that there are damaging people in the cabinet and it is costing American lives on immigration, on this war in Iran. But it's quite possible that the greatest amount of damage is being done at the HHS because of this anti-vaccine nonsense.
There's no doubt about it. I mean, if the war in Iran is like the acute illness of the Trump administration, RFK Jr. is the chronic disease, and the consequences are going to last many lifetimes. It's really hard to reverse mis and disinformation when you put it out there. When you start telling people that the things that they take, or more importantly, give to their kids to help them, actually do damage, at some point the consequences last for a very, very long time, and it's hard to put the genie back in the bottle. And it didn't just start when he became HHS secretary. It started years and years before when he decided to declare, I don't know, a jihad against vaccines for God knows what reason. And now,
well, there are some speculations about the reasons, and one of them is that he launches lawsuits and makes some money out of it.
That part. And here's the thing, this is the key point. Him and the grifters around him have made huge amounts of money lying to the American public. Because, of course, if they tell you that the thing that actually works doesn't work, they're trying to sell you the thing they tell you does work. And guess what? At the end of the day, when they've cut all the objective science out, they leave you going back to them.
So let's talk about cutting the objective science out. The CDC, and one can argue that it's got its flaws and needs to, everything can be done better. It was the gold standard. The funding that goes to universities, for the NIH, that is the gold standard, right? It is much better than setting up a big building and saying the government will research all these medications. We have some of the best ways to identify and cure illnesses in the entire world, and they've been slowly dismantled.
Yeah, I mean, I want us to understand that we've taken for granted our leadership on science and healthcare for a very long time. That didn't just happen. It's because we invested in rigorous science. We followed questions where the answers went, and then we invested in those solutions. And over time, when you start cutting that away, the long-term consequences become pretty great. I mean, think about this. There are people who are going to die of diseases we might have been able to find the cure for, but for the fact that because of Doge and RFK Jr., that we defunded the incredible scientific.
And that might be a disease that I get diagnosed with in 20 or 25 years that can go one of two ways. The doctor can say, hey, there's this great new medication, take it and we cure you, or sorry, you've got 6 months to live, because I don't know. Somebody's working on something today or may have had their funding cut today for something I don't know will result in a cure 20 years from now.
And that's the thing is, you know, when Doge happened, they started just cutting where they thought, oh, this doesn't make any sense.
Right.
But think about GLP-1 drugs.
Yes.
I mean, these are pretty close to a miracle drug.
Yes.
And it happened because of obscure research on something that had nothing to do with
the saliva
obesity.
of the Gila monster.
Exactly.
And people would say, why would we be studying such a
Why
thing?
do we care about the saliva of Gila monster? Well, it turns out that when you characterize the world around you, people can connect dots, and it turns into things that can be miracles.
Right, and really a miracle, because it will reduce people's weight, it will reduce people's risk of diabetes and heart disease,
cancer, all of it.
Yeah. So let's go back to measles for a second. Declared eradicated in this state, in this country in the year 2000. No cure for measles. If a little child, if 10 people are in a room and they're exposed to somebody with measles, likely all of them will get measles.
If they're unvaccinated, yes.
Yes.
And this is the thing about it, is that measles is like, it's like the genie that escapes from the bottle. You can't put it back in. You're talking about outbreaks now that are immensely difficult to trace. And the hard part about this, and I want folks to understand, is that not everybody can be vaccinated against measles. You are not eligible for a vaccine until you're 1 year old.
Right.
Now think about what happens.
So you're a little baby, you get on a plane, you're not vaccinated, and somebody there has measles.
Exactly. That choice is now putting all of our infants at risk. It turns out that we live in a society with each other, and the things that we do affect each other. So when somebody makes a choice not to be vaccinated because of mis and disinformation from the HHS secretary, the consequences can ripple into a baby who gets sick and potentially dies as a function, not because their parents made a bad decision, but because that child does not have an immune system that can even undergo vaccination.
So as a public health official and an epidemiologist, talk to me about, you were talking about mis and disinformation. Back before we had political mis and disinformation, the first mis and disinformation on the internet was about health.
Yeah.
It was nonsense about rubbing potatoes on your child's feet to keep them from getting diseases. That spreads faster than anything.
It does, because here's the hard part about vaccine. You're asking somebody who is healthy to willingly put something in their body. And that is an intervention that's not an easy thing to do.
Right, it's not a natural thing to think about.
It's not a natural thing to think about. And so anyone who tells you that that thing might do you harm, especially considering the fact that right now you are taking a bet that you might not be exposed to the disease in the first place, makes it really easy to target. And here's the hard part about it. Pharma has something to do with this, because at the end of the day, they make good medications. They just make them too expensive to be able to afford. But when you feel like they're trying to pick your pocket, it's not a far leap from that to, well, maybe the things they actually make are bad, right? That leap is one that, unfortunately, our healthcare system, so focused on the money that gets made, has created an opportunity for, because you've created a push factor for people. And I want us to understand what the impact of that looks like over time. And so you've got folks who are mis and disinformation mongers, folks like RFK Jr., who say, well, you can't trust anything Big Pharma does. And by the way, we've got the solution for you.
Right.
And so you've got grifters who are feeding off of the greed of the industry to create a perfect storm in which people are making decisions that are putting a lot of folks at risk.
Does this come up when you're campaigning?
All the time. I'll tell you a story. I was out in the city of Detroit at the height of the pandemic, and I was trying to get people to take this vaccine for COVID. And I was having a conversation with them. There was one gentleman, he said, listen, Abdul, I know you. I've seen you around. You were the health director. I trust you. I'm going to take this vaccine. But I want to tell you something. You're asking me to take a vaccine that didn't exist a year ago for a disease that didn't exist a year ago. I'm diabetic. How come y'all don't show up to make sure I can afford insulin, which has been around for a century, for a disease I know I have and I've had my whole life? And at that moment, I was like, you know what? That's a damn good question.
That makes a lot of sense.
And so we've got to understand that public trust is earned and it's easily lost. And so it's not enough just to push back on RFK Jr. if you're not doing the structural work of making sure people have access to the health care they need.
There was a chance of giving everybody their insulin at a low rate, and we didn't.
I mean, they do that across the river from where I live.
I know it well. It's where I'm from. Nice to see you again.
It's an honor to be here.
Thank you for coming in.